to be good to be able to share with you today. Let me tell you a little bit about me, and I'm going to give you a little bit of background about geriatrics in general and geriatrics at KU. I am a geriatrician here at KU, and I see patients in the outpatient setting primarily, both in primary care and consultative care. But a big portion of my world of what I do is teaching. I really enjoy, we teach every single medical student here at KU about these changes with aging, as well as diseases with aging. And we teach all of the internal medicine residents. We teach all the family medicine residents. We teach lots and lots of people because we really believe strongly that even if these students are going to be surgeons or emergency room doctors or an endocrinologist or whatever they do in the future, they're going to see older adults, and they should be familiar with what happens as you grow older. So I really love being able to share this. Let me tell you quickly about geriatrics, that we focus on the 5 M's. We feel like this is a really good way to summarize in a nutshell what we do. It's really not age-based. It's not like you hit a certain age and it's appropriate for geriatrics, but it's having one of these issues, this multicomplexity. I'll talk about it more in the talk here, but it's that not just managing one disease or one condition, but the people as they get older have lots of different things, and you have to balance taking care of one thing in light of something else. We focus on mobility, medications. There are special issues about medications as you grow older. Mind, so that has to do with memory and mood and what matters most. And so those are things like quality of life issues. So I've told you a little bit about geriatrics. Let's talk about what happens normally with aging. I like Queen Elizabeth. I think this is an interesting picture comparing Queen Elizabeth and Prince Philip when they were young and then at an older age. And you can see some of these changes that have happened. We all know it's inevitable. Things are going to happen as you grow older. And I think the fun, fascinating thing is the experience is totally different for each person. This is another picture that I like so much. The same man, 85 years later. Isn't it cool? You can see, of course, the obvious things that we know. You know, his hair gets thinner and white instead of dark. His skin has changed to it's darker and has all the sunspots and the wrinkles, and his nose is bigger and his ears are bigger and his chin is bigger. Those are normal changes with aging. His eyelids are droopier, but and you can see also just a little bit more of a broadness of his chest and the very slightly hunched over. Those are all things that happen with aging. So I could go through every single organ system and say, oh, this is what gets worse in the kidneys, and this is what gets worse in the heart, and so forth. But I think not only is that get kind of boring, but it's also a little bit discouraging. So I have opted today to talk about things in a little bit different way. These are the 9 points I'm going to make. Many of these I'm going to go through really quickly, but the points you can see here. First of all, I'll tell you the theory behind what's normal aging versus disease, and this heterogeneity. And that means that as we grow older, we're more and more different than each other. Factors that affect aging. And then I will spend some time talking about individual organ systems, but then talking about really how does that affect how you live your life? How does it affect your function and life in general? And then we'll end on how can we improve our health, accept change, and adapt to change. Well, this normal changes of aging versus disease is interesting to me, theory. And boy, I could talk about it for a long, long time, but we'll just in brief. Some of this is to a certain degree arbitrary. So a good example is arthritis. Pretty much everybody has some joint changes as you get older, some degenerative changes to your joints. And when is the time that that becomes officially a diagnosis of arthritis? We've had to come up with some labels, but it's different. If we took x-rays of everybody's knees in the room right now, we would find that some people have maybe degenerative changes that look like arthritis, but they would say, I don't have any trouble with my knees, they're fine. Another person has a lot of pain and aches, and their x-rays may not look as bad. There may not really be very many changes. So it's some of it has to do with physiologic changes that we see, but some of it is the experience too. How much does it bother you? Some of the conditions, there are reasons behind putting a label on it. In Alzheimer's is a good example. Years and years ago, we used to just call it senility, getting old. She's just senile. But at a certain point, we realized, well, something's different changing. And when are we going to put that label on it? It does have to do with being able to talk about something and accept it and work through things. But also having identified label helps with research and getting funding for research and having a target. If you're going to treat something, we're going to have a label. We're going to treat it. It's a disease. And that was kind of the evolution of making a diagnosis of Alzheimer's disease. Well, I could talk about this for a long time, but hopefully you get the general idea that there are, as a certain point that we defines, we can say it's normal versus it's disease. The next thing I'll talk about is this heterogeneity. William Osler was kind of the grandfather of academic medicine in the United States. And he said this variability among people is what lends medicine to be more of an art than science. We do really focus on science as well, but I say it's partly the reason why robots can't be doctors, is that people are different. And so not only are people different, but the older you get, the more different you get. So the example here is, so if you had 30-year-olds and you took a group of 30-year-olds and you measured their lung function and their cardiac function, and there would be pretty narrow variability, that they all would fall. There might be a little variability, but they would all fall within a pretty narrow window of what is normal. But a group of 80-year-olds, and you would test those same things like their heart function and their lung function and all of those different parameters, it's a broader definition of what's normal. So whereas a 30-year-olds would all fall into this smaller range of normal, older people would have your normal if you have the function of a 30-year-old, but it's still normal if your function has declined a little bit of. So you get the idea that well, here's another, I have a slide here that this is a little harder to see, but you can see in the 30-year-olds here that normal, this is blood sugars first thing in the morning, range from about like 70 to 110. But as you get 80, normal blood sugar runs from about 65 to 130. So it's just a broader range of what is normal. And so that not only happens in every organ system, but each organ system is different. So individuals are more different as they get older. It's kind of cool. This is pretty logical. You all are going to say, sure, this is not, but it's interesting to talk about that the things that affect how one person might age at a different rate than another person. And different ways that you age are different. So we know, of course, heredity is some of it. And those things that you're exposed to in your life, like your environment, someone who grew up in a toxic environment, or somebody who grew up in the city versus living in the country. Those environmental things affect our aging. Your activity and your lifestyle affects your aging. Food most certainly does, as well as the social support and the things that have happened in your life to affect your mental health and so forth. The physical diseases most certainly affect your aging. And unfortunately, a lot of this is just sometimes maybe bad luck. We don't have any other reason. One person is going to get cancer and the other person isn't. And of course, that's going to affect your aging. So next I will go through some of the organ systems and talk about some of the changes. This is not meant to be completely comprehensive, but I just thought there might be a few interesting points about some of the organ systems that you'd like to hear. Well, this is in the muscular system, and you can see the diagram here. You're at your peak muscle mass when you're, say, about 25 years old, and that declines gradually over time. You can see this blue area. When you get in the blue area, there's a zone where risk of death is high. This is a cross-section of somebody's arm. It's not a real cross-section. It's actually through a scan, an MRI scan, but it shows the percentage of muscle versus fat. And you can see, like in a steak or something, that you could see that there's more marbling as you get older. There's more of the fat infiltrating the muscle. And the muscle mass here is still decent, but not as much as the muscle mass in a younger person. And the amount of even fat surrounding the muscle is a little bit more in older people. Hearing isn't something else that's commonly lost with age. You can see that at least 50% of those over age 70 have some hearing loss. We like to think of hearing loss as something to focus on because we have a treatment for it. However, being a geriatrician for over 30 years, I realize that it's still imperfect. I know many of you probably have the experience, like, there's some nagging going on. Why don't you wear your hearing aids? And the reason that people don't always wear their hearing aids is they're still imperfect. But it is something that we can do. Oh, I think a fun fact about this is much of the hearing loss when you get older is in the higher tones. And so the response when people have hearing loss is not to speak louder and higher, but to speak lower and more clearly. And speaking lower and more clearly, people are going to hear you better than screaming. Vision, changes with vision. With age, most everybody develops cataracts as they get older. That's this lenses. When it says lenses hardening, that's what cataracts are. Thankfully, I'm super thankful that we have an easy and effective way to deal with cataracts. We can quickly take out cataracts, implant a new lens, and people are not becoming blind from cataracts. And years ago, there were a fair amount of people that were getting blind from cataracts. And so that is something wonderful in medical technology that we've been able to do in recent years. Skin, of course, we all know skin changes with age. That's something, of course, very visible. So everywhere from the easy bruising on your skin, and skin tears more easily because these the epidermis and dermis, as you get older, are not held together quite as tightly. We all get wrinkles to a certain degree with age. Here's another interesting diagram about age. You can see with skin, you can see these fat pads in your faces change with age, and that's partially why your face changes because of those fat pads changing with age. This is not a real good picture, but the vascular system, you can see our blood. These are your blood vessels. Blood vessel in a younger person, blood vessel in an older person gets thicker and stiffer, and you can see. Oh, this was. They can get this clogging the cholesterol plaque buildup in your blood vessels, and that can impair your circulation. In the digestive system, things slow down a bit. People may be a little bit more constipated. I think as you get on the old, there's even more loss of appetite, and your taste buds are not as sensitive. And so, you don't taste and smell as well. And people tend to want to eat more sweets because that is the one thing that's pleasurable and you really can experience more than some of the other tastes. This is just kind of a funny kidneys versus adult knees. But one of the things that happens with your kidneys with age is that they don't concentrate urine as well. So a young person, a kid can sleep all night. They could sleep 12 hours without having to get up and go to the bathroom. But as we get older, our kidneys are not concentrating urine so well. So most of us, when we get older, have to go to the bathroom every few hours. And so that, of course, impacts our life. But that's normal, that our kidneys are not working quite as well in the concentration department. Sexual function, we know that our hormones decrease with age. This is an example of men. We know that women, every woman hits menopause where you don't have the same sex hormones. It's just a fact of life that changes. Let's talk about neurologic. These are some of the things that are normally changed in the neurologic system. Balance is one. So there was, I think, a very interesting research study on adults. It was on young people versus adults on balance. And what they did is they put a laser pointer on people's heads and had them stand and watched the balance and watched what the laser did on the ceiling with the balance. Young people had a small little circle on the ceiling because if they swayed a little bit, they were able to be able to adjust with small adjustments. Older people, that circle on the ceiling got really big because there's more sway. They were able to keep their balance, but they were swaying more to keep their balance. And so that's just normal. We don't have as tight of control of our balance as you get older. It is natural that our reflexes are slower with age. And then cognition, what's normal with our thinking and with age is that we're slower. We're slower to recall things. So if a perfect example, I bet most of us can relate to this, is that you see somebody you've known for years, you can't think of their name, but later on you recall it. It's just takes you longer to pull it out of your brain, or you go into the kitchen and you can't remember why you were there. You finally, later, you do remember it. That is not dementia. That's just that slowness with age. It's slower to learn new things. It's slower. Your mental flexibility is just not quite the same with age. Well, and then here is another on the kind of the musculoskeletal. You can see that things do, we become less strong and less flexible. Here's a diagram. Even men here who are doing regular strength training, they lose their strength when you get to be 80 years old, despite doing your best. But granted, it's a lot better than those who are not doing strength training. So it's good to do what you can to keep up your body with age, but things nevertheless do change. In general, most of our organ mass decrease, things atrophy with age. You can see in different organ systems here, but this LV is left ventricle, that's your heart. Your heart is your one organ that, of course, is constantly working your whole life, never never getting a break, and it gets hypertrophied with age because of working so hard. Well, so as I said, that I was not exhaustive going through every single organ system, but you get the idea here. Next, I'm going to just talk about some of, not just on the individual organ system level, but kind of overall health level, some of the things that change it, because these are interesting and they're more important to more of a global issue. We're more than just the sum of our parts, right? And so here's some examples. One of them is sleep. This is sleep studies in a young adult versus an older adult. So the N3 here, getting to the N3 is the deepest level of sleep. You can see in a young adult, they spend quite a bit of time in the deepest sleep. The R is REM sleep, where we dream, and it is, the REM sleep is very restorative. Again, a little bit less total time in REM sleep in the older adult than the younger adult. And these spikes here are wake times. So in a young adult, there's a couple of times when they're sort of awake, but then they fall back to sweet sleep very quickly. In the older adult, there's more times of coming to that wakefulness. And sometimes it is even longer that you spend in that wakeful time. Another thing that changes with age, that's not just one organ system, and it's really hard to wrap our hands around, is energy. I think we all know that energy, you just don't have as much energy as you get older. It's hard to measure that, how much energy you have. The best way we have to measure energy is both how much energy you spend. And so you can see as you get older, you spend less energy, but also our resting metabolic rate. This is resting metabolic rates and how that changes both in men and women over the years. So you can see that our metabolism decreases gradually over years. This kind of relates to, we just don't need as many calories when you get older. You can eat the same amount you always ate and you're going to gain weight in middle age because you don't need that many calories as what you used to eat. And I would say, being a woman, this just confirms that it doesn't feel fair that the men's metabolic rate is always higher than women's, and that's why they can eat the same amount as we can, and we're going to gain weight and they don't. So those are things that we can see. Oh, here's another interesting one. This clear box is the time spent as young people, time spent standing and sitting, and as you get older, more time spent sitting, less time spent standing. So that changes with age. I love this idea of the reserve. Our reserve declines as we get older. And once again, it's really hard to measure. We don't have good, like that energy. We know that this is true. We just can't measure it too well. But we know this diagram represents the internal cylinder here, represents where you maintain normal homeostasis. So that's where you normally function and live. And the outside of this figure represents where you can be knocked out of normal and still be able to recover. So in a young person, they could have a huge, say, let's just say kidney injury, and their kidney would be able to bounce back and come back to normal. An older person with that same injury to their kidney may never come back to normal again. And that's true, of course, in all these different parts of our bodies. And the decline is different for different people. But it's not just individual organ system, it's just people too. We just don't have the same reserve as we get older. You can have this, if you had some huge insult, a young person may be able to recover, but an older person would have more trouble functionally coming back to being completely independent. And stroke may be a good example of that. A younger person with a big stroke may still be able to, say, live independently, but as you get older, having that, you may never be able to completely bounce back to living completely independently as you did before. Here are some other things, kind of the general changes with aging. Sarcopenia means loss of muscle mass here. So loss of muscle mass makes you weaker and less power and less endurance. And you can see, we call this in geriatrics a cascade. One thing leads to another, leads to another. So these things lead to consequences like more disability, less physical activity. Some of the other general changes with aging are things like fluid status. We know that as you get older, it's easier to get dehydrated or easier to have the adverse effects of being dehydrated. On the flip side, it's easier to get fluid overloaded. So that does kind of go back to that less reserve situation. The pharmacokinetic refers to that medications. As I said before, medications are the way that you metabolize medications with age. There are more sensitivities and more concerns about that. So we have to be real careful with dosages of medications and multiple medications as you get older. Another thing in medicine is older adults have more vague symptoms. So you may be really ill with an infection and not have the same fever. A young person gets really ill, may have pneumonia or something like that, and they have a high fever. As you get older, you might just have a minor change in your temperature. The blood pressure and pulse, same thing. A child with a really ill with an infection, their pulses, their heart's going to be racing. Older adults, we may not have the ability to get your heart rate up so high, or just don't respond in the same way. Somebody older may be ill and it's hard to say. It's hard, I don't feel right. It's hard to say exactly where you hurt or what exactly is wrong. Sometimes it's just, the family will say they're kind of confused. I think something's off, but I can't tell exactly what's going on. And these vague symptoms like being weak or just not drinking as much, they're unsteady or not acting right. So this makes it in geriatrics, we have to be more attentive to hearing the whole big picture and listening to family members and all the symptoms and looking at medications and doing a good physical exam, because it's not quite the same. It's not as exactly the way that we learned in medical school. Now, so those, I guess, let me just say that, and I'm going to kind of say that those are the things that kind of change on an individual level. But next, I'll talk a little bit more even on a population health level, that in general, the number of chronic diseases rises with age. So the older you get, the more things you get. We call this multi-morbidity. So it's interesting to me. Years ago, somebody would maybe die of a heart attack when they were 50, but because of medical interventions and the health prevention and the medical care that we have, we might be able to nip that in the bud and really treat somebody's heart disease and prevent big heart attacks and prevent a lot of the bad consequences or hospitalizations or early death. The same person may end up dying 30 years later of heart disease, but we were able to push off that death for several years. But if you live those longer years, you have more, you live long enough to get more conditions. You may develop diabetes and several other different conditions. So the longer you live, the more those things pile on. And so we have to be careful and be attentive that we're trying to manage several things together. Well, let's talk about what, I guess I would say we'll talk next about what's good with aging. And maybe you guys can tell me some more things too. But Oscar Wilde said, wisdom comes with winters. And I think that there is that wisdom that comes with age. I think the hormones and a lot of the things that influence our decisions and impulsivity and jumping to quick conclusions are less bothersome with age, and we can have this better emotional intelligence. You know, emotional intelligence kind of refers to that ability to identify your own emotions and manage them, as well as relate to other people's emotions and say, not focus on the externals, but what's underlying. This person that's yelling at me, maybe I don't need to focus on the words so much, but recognize she's angry. And what about that? So there are other good things too. People tend to recall positive memories more, let go of negative feelings, be better at making decisions even. And here are some other things that I put this on a bright slide because I think some other positive things that get better with age. So you can look at the list of them here. Hopefully you guys can think of other things too. So that's kind of the way that aging affects both organ systems and general health. But next I'm going to transition and talk about our function, because we're not just diseases. We in medicine tend to put labels on things and say, this is a 75-year-old with stroke and diabetes and hypertension and so forth. But you can have all those things and be living completely independently, or you could need more assistance. And so we think a lot in geriatrics about function, about how people are functioning. We think about their ability to be independent in the managing the instrumental activities of daily living, that is, taking care of themselves at home, as well as our activities of daily living, like taking personal care of ourselves. So we try to optimize that, think about that and optimize that, do the best that we can to support people in their functioning. But the truth is, these things change with age. As much as nobody wants to be dependent, but there is a certain amount of dependency that just we need other people as we age to different degrees. We may need other things like our canes or our walkers, or sometimes those are going to change to a certain degree with age. Some of the other things that happen with age, and the losses of friends and family members and income and health and independence. You can see this is an interesting graph here about what people fear most. Losing independence is a huge adjustment. We're used to living in a world where we have so much ability to make decisions on our own and do our own thing and fulfill ourselves. But that does change. So now that we've talked about a lot of things that could be discouraging, I'd like to turn around and say, how are we going to deal with this? A certain amount of things are just a part of life. How can we best deal with it? We can work on improving our health, accepting changes, and adapting to changes. So we really can try our best to optimize our health. You can see pictures here from trying to eat right, being with others that you love, the guy here playing cards with his friends, doing enjoyable activities. This woman is looking at an iPad, so she's trying to keep up with technology and also staying connected with others and keeping her mind stimulated with the iPad. Physical activity is wonderful. As much as we can do to try and keep ourselves physically active, that's the best that we can do, is try and take care of our bodies. Here, oh, here's some other pictures that I like too. This is from a photo contest that we had at the Landon Center on Aging about aging in Kansas. And you can see things here from being with young people and being outdoors and things you enjoy, and being with friends are really good for your health. And it's really a balance of all of those things. Well, sometimes I am frustrated when I read things. Sometimes they're on the internet, or read things about aging, and then it just ends with, yeah, just exercise more and eat right and do things more. And that's all great. We should do that as much as we can. But guess what? Things still happen. You can be the best, have the best diet in the world. You can be super active and fit, but things are going to change when you get older. And I guess this has been pretty shocking to me when I see people that have been really healthy, and then when they kind of hit the wall, which happens pretty much to everybody, we get to a certain point. If you live long enough, that you're going to need more help. Things are going to change. Your body's not going to be the same. And it's hard. It's emotionally hard. You do have to kind of come to this acceptance. But I've had quite a few patients in their 90s, and then they get to the point that they need help and they're mad. But you have to recognize that most of us are really going to have to deal with that to a certain degree. And we did not only accepting, I think even recognize a little younger in life, recognizing in middle age and early aging that things are going to happen and we can adapt, right? I think the best that we can do is this adaptation. So many people do this well. When you're faced with something major that happens in your life, many of you that have gone through strokes have probably really done this, that say things are not the same. Things are not exactly as I hoped they would be. Things are different. I'm going to have to make some adjustments. I may have to have different goals. Maybe I thought I could live completely independently, and I realize I'm not going to be able to live completely independently. But we can do that well. We have the capacity. It's hard, and you have to go through that period of figuring out, of readjusting and figuring out what's something else important that I can focus on. Maybe you are a golfer and you're frustrated now that I can't golf. I always wanted to golf. I thought I could keep golfing, but I can't. Maybe you could focus on young people that are golfing and helping support them, or teaching your grandchildren to golf, or something like that. There's lots and lots of ways that I'm sure that you all have good examples of good ways to adapt to the changes that happen as you grow older. Well, that's mostly what I wanted to say. I really like to summarize with this. We need each other, because I recognize that people want to be independent forever. But the truth is, we're interdependent. We can't live completely independently. That's really an illusion. We need each other. We need our families. We need the other people around us. And we need them, and you may need them more as you get older, but they also need us too. We have things that we can give to other people as we grow older. And I hope that this is a way of helping us successfully manage with some of these things that happen as we grow older.